my name's David Smith, and I started the webinars, brought together some really talented people, and we decided that what we wanted to do is create a series entitled Achieving Your Optimal Health, and each bring our own modality into this discussion. We take turns leading webinars, and so I placed these on my trail site, which is my main business is marketing. Unlike the other people here who are professional health providers, yet I do have a love of trails and getting in the outdoors, and so I do have the closest thing to a health site that I have is Las Vegas area trails, and you click on health education link, and you can see the webinars that we have completed thus far. We started out January 12th, 2019. And for a time we were doing the webinars every week. We went to every other week, but we still at this point, we have something like close to 25 webinars that we have done on a number of different topics. And I got to tell you, this team has poured their heart, their experience, their knowledge, wisdom into each webinar presentation, as you're going to see tonight. And so the reason I say that is that you look at the titles here, every single presentation, it just really is packed with valuable information and insight, and all around the theme, achieving your optimal health. What makes for optimal health, and how can each of our people present what, from their perspective, from their profession, what they have to share regarding ways that we can achieve our optimal health. And tonight is Denise Tropea, Dr. Denise Tropea, on boosting the miracle of microcirculation. And let me, you click on, I just clicked on the link on that main page, went to her blog page. Everyone has a blog page. The webinar replay video will appear here following the webinar. But I just wanted to give you a little bit of background. Who is Dr. Denise Tropea? She's a board certified foot surgeon, has maintained a private practice in Las Vegas for 25 years. They say that, I've heard it said a number of times, that just about every area of the body, everything that can happen, has a kind of a sensory area in the foot. So Denise definitely was in touch with, through her whole career as a podiatrist, definitely in touch with a very key part of the body. She's originally from New York and the New Jersey area, completed her studies at the Scholl College of Podiatry in Chicago. She then went to complete a 2-year residency in surgery and orthopedics in Salt Lake City before opening her practice in Las Vegas. In 2016, she closed her practice in Las Vegas to follow her passion in health and wellness. Her knowledge of medicine, treatment of chronic conditions, the importance of supplementation and exercise, along with her extraordinary skill as a health educator, give her the cutting edge in assisting people in creating their optimal mind, body, and soul health. So I just, I'm not going to read the whole thing, but just want to say that Denise is one of those rare people who span traditional medicine and alternative medicine, and so hearing from her is a real treat. And I want to jump up to, each of our webinars, we just have a few statements. What are you going to learn in this webinar? And you're going to learn how microcirculation can hold a key to preventing diabetes, blindness, tissue death, brain disease, high blood pressure, kidney disease, and kidney failure are mitigating the damage caused by these debilitating health conditions. And so that's going to be interesting how Denise presents this. Truly valuable. So we're going to learn what is at the root of poor health. What is microcirculation? How does it work? How does our immune system work? What are capillaries? What is, and I'm sorry, I might need your help on this one.
Anastomosis.
Thank you so much. And superficial A-V Anastomosis. Okay.
Anastomosis.
This is why I'm a trail runner and not a podiatrist. How does oxidative stress contribute to microvascular disease? Can we increase microcirculation? And let's hold Denise to this. By the end of this webinar, we're going to understand the origin of debilitating health issues such as diabetes, blindness, tissue death, high blood pressure, kidney disease, kidney failure, and brain diseases. We're going to learn how boosting your body's microcirculation can help prevent these diseases or mitigate their damaging effects. We're going to learn how your immune system works, how you can strengthen it. And we're going to move closer to achieving your optimal health regardless of your age or current health condition. So, Denise, I'm going to go ahead and turn this over to you. It's a real honor to have you here.
Okay.
Oh, let me unshare the screen. Stop.
Oh, yeah, right.
Sorry about that. Yeah.
Oh, okay. There we go. Oh, share. Okay. All righty. So now let's get started, and I will. There we go.
Awesome.
And here we go. Okay. Thank you very much, David, for the introduction. And I am truly pleased to be here this evening to speak to you all about microcirculation, something that we, really don't think about every day.
No, I'll just listen to it this way.
But it is important. Important in the factor that it just controls so much of what goes on day in and day out with our bodies and how our bodies function, and how we can get the balance of our bodies by proper microcirculation when it's working effectively. So first we want to talk about what's at the root of poor health. Well, things such as cellular debris or toxins that build up in the cell that can cause a cell to die off prematurely or mutate, fluid imbalance between the blood and tissues, and that's also a part of the lymphatic system that I will talk about, a weak immune system, susceptibility to disease. And the take-home message with a weak immune system is there are people that can get the flu and actually die from the flu. And that's because their immune systems are not functioning properly and being up to par. And then malnourished cells in which not enough circulation is getting there, or we're not feeding our body the proper nutrients so our cells can become healthy. Other factors can be poor thermoregulation, in which our bodies are not controlling and keeping the core temperature stable the way it should. Poor oxygen exchange, resulting in the buildup of waste, which I will talk about today, and how microcirculation, that's its main function, is for proper oxygen exchange. And then damage to cells due to free radicals and toxins, overload that our body has to contend with every day, especially in the world we live in today. So with these issues, we may not realize a lot of the things that I talked about, but we do know that when these things do occur in our bodies, it's happening on a cellular level. And that's where certain things such as diabetes, blindness, brain diseases, Alzheimer's, dementia, traumatic brain injuries, high blood pressure, kidney disease, kidney failure. And then also let's name a few more, such as chronic pain syndrome, such as fibromyalgia, which is a type of pain that can manifest itself in many, many different joints and muscles and form a chronic pain situation that can be very debilitating. So when we talk about something as like diabetes, diabetes is known as a small vessel disease. And that's where microcirculation comes in. Because when the uncontrolled blood sugars are damaging the eyes, the very small vessels of the eyes, very small vessels of the kidneys, and then also the small vessels of the feet, being furthest away from our heart, then damage results. And then such as tissue death, which is gangrene of a toe, let's say. And this is something that can happen quite quickly when someone is a long-term diabetic and doesn't realize all the damage that's going on inside of their body until they're able to see some outward sign. And look at kidney disease. Really can't see what's going on with our kidneys except for some blood work. But we do know is that those small vessels can become damaged. Eventually they will not function, and then a person would have to go on dialysis. And now we're finding that a good portion of kidney disease that can lead to dialysis is uncontrolled high blood pressure, in which years ago it was not adequately treated through medication or lifestyle changes or diet, reducing the amount of sodium in your diet. And what has happened is that it has led to uncontrolled hypertension, can lead to kidney disease. And so now we're seeing that a lot of these different conditions is all related to our microcirculation. So what do we mean by microvascular? Well, vascular means the vessels, the conduits, the little roads that we have in our towns. And then the microscopic conduits, that's microvascular. So as you can see that picture, you can see where you have a larger blood vessel and then it's branching out into the very small blood vessels. It almost looks like a tree. And that's exactly what the microscopic conduits are. They're the very small branches and the leaves of the trees that need to get nourished just as much as the big branches and the trunk of the tree. So circulation of the smallest of blood vessels is present in all organs and tissues. And those microvessels are their arterioles, the venules, the capillaries. And the arterioles, they're coming off the arteries that are carrying oxygen and blood to the capillaries. And then blood flows out of the venules, the small veins, into the larger veins. Then it goes back into the right side of the heart, into the lungs, gets oxygenated, and then the whole process starts all over again. And it takes a red blood cell approximately 20 seconds to go through the whole process of our body, from start to finish of proper oxygenation to deoxygenation. So 20 seconds to go through that whole process. So how does microcirculation work? Well, the vessels of the microcirculation are lined by endothelium. And these are flat cells that regulate the movement of water and dissolved materials between the blood and the tissues. And then pericytes are surrounded by the endothelial cells and are made up of smooth muscle. So it's almost like the pericytes are working to pump the cells and all the fluids, and as it works in concert with the heart pump. And then when vessels lose pericytes, so they die off, they become hyperdilated, they enlarge to the point where they rupture, hemorrhagic, they get bleeding, and that can lead to conditions such as swelling and retinal damage to the eyes. And that's the main cause of diabetic retinopathy, retinal damage, which can cause blindness. So we can see that these little vessels are going through so much trauma because the body is not working adequately. You're having increase in blood sugar that's causing this to happen, or you're having lack of blood flow. So with microcirculation, responsible for three main things, and that's blood flow regulation, removal of carbon dioxide and wastes, and then delivery of oxygen and nutrients to our cells. So that's what it's doing on a continuum. It must do that in order to properly function at its highest capacity that it can. So how does our immune system work? Well, then we have to bring in the lymphatic system, which is a very huge portion of our immune system. As you can see in that schematic drawing, we see the red lines, which are that's responsible for the arteries, the blue are the veins, and then surrounding it, the yellow, that's the lymphatics. So this schematic actually gives us that relationship of the importance of the lymphatic system that is considered part of our circulatory system, that collects fluids and proteins that's escaped from the cells and brings it back to the blood. And it's responsible for removing all that cell debris and toxins, and it must maintain balance of fluid between blood and tissue. When our lymphatic drainage system is not working, some of the manifestations that we see is swelling in the lower leg. It's called edema, and it is going to swell there because then gravity takes over, and that's the lowest part. So it's going to go to the lowest part, all those fluids. Those fluids then escape from the blood into the tissues and give an appearance of a very swollen extremity. And if this tends to keep going and going, what we do see is sores that can develop, poor circulation, and also a lymphatic system that no longer does work because everything is clogged. The pipes are clogged, the drainage system is not working. And it is a key player with our immune system, helps us avoid infections and keeps us healthy. So another part of the microcirculation is the capillaries. They're just a fine branching of blood vessels between the arterioles and the venules. They comprise 75% of our whole circulatory system. So I know a lot of times when we think of circulation, what do we think of? We think of the heart, we think of the main aorta, which is in our stomach area, our torso. We think of the carotid arteries, but it's so much more than that. We have approximately 100,000 miles of capillaries in our body, so that's pretty phenomenal. And its job is supply blood to the tissues which carry food and oxygen to the cells, and forms that very, very important exchange of oxygen, carbon dioxide, and metabolic waste products. Here is a photo of an arteriole, a venule, and the capillary bed. And you can see this is where at the capillary bed where all the exchange takes place. So proper opening of this capillary bed is so important. If the capillaries are shut down, then we're not going to get blood and nutrients to our organs. And as you can see here, there's an arterial venous anastomosis, or a shunt right there. And that shunt vessel is under the influence of the sympathetic nervous system. It's the part of the nervous system that is in fight or flight mechanism. So if our bodies are under a lot of stress, or we're in traffic and we're having a panic attack, we see that the sympathetic nervous system is going to be in high gear, and it's going to clamp down on our capillaries on those very small microvessels and reduce the amount of blood flow to very, very important organs, which are pretty much all of them. They all have a reason to be there. When our body is not under influence of a high degree of sympathetic nervous system, then the other side, the parasympathetic nervous system, comes into play. And that's responsible for everything that's the opposite of the sympathetic. Responsible for vasodilation, so it's going to open up the vessels. You're going to get more blood flow. You're going to feel so much calmer. It's like when you're watching a sunset or playing with your children or just, doing yoga. It's just something that's so relaxing. So you're getting more blood to your body. And then another anastomosis is a very important one, is the artery to artery connection that's seen in the hand, the palmar aspect of the hand, or the plantar aspect of the foot. And that's a schematic of that anastomosis in our hand, which is very important as well, especially for delivering circulation to our fingertips and toe tips. Superficial anastomoses are direct connections between the arteries and the veins. They play a role in thermoregulation. So whenever we go out in the cold and our hands are very cold, and our feet, it's because we're trying to keep our core body temperature at a constant level. So that's why they're found in abundance in the nail beds and in the toes. So now we talk about microvascular disease and the amount of stress that is put on it. It's oxidative stress. And it's damage due to free radicals, toxins that build up in the body. And the body has to neutralize out these toxins. And that's why antioxidants are so important. So antioxidants can be anything from the tea that you drink, the supplements that you take, fruits and vegetables, so important. They're loaded with antioxidants. All your green vegetables, your yellow vegetables, reds, purple, etc. They're all so important antioxidants to combat the toxins that are in our body day in and day out, whether they're from internal or external sources. External sources, the air we breathe, the water we drink, the foods we eat with preservatives. The list goes on and on. So optimal microcirculation is necessary for over 500 trillion of our cells. They all need oxygen, water, nutrients in order to remain healthy. So how can we increase microcirculation? Well, there's been many studies that have shown there are scientific backing to this, and I'll discuss that in a minute. But we want to turn up the heat. Yes, when we turn up the heat, we have vessels that dilate, more oxygen is being delivered to the tissues. The thickness of our blood becomes thinner and flow is improved. And the best analogy is that if you have a bottle of honey that's been in the refrigerator and you're trying to squeeze it out, you can see that it's very thick. But heat up that honey, and what does it do? Nice and flows. It flows. So that's exactly what increasing your body temperature will do. Inflammation will be reduced due to more effective detoxification at the microvascular level. And also, it makes sense that different hormonal processes, enzymes, everything is being optimized to relax the vessels and decrease blood pressure. And then you're going to get an increased transport of oxygen. You're going to get a lot of increases in a lot of different chemicals in our body, such as nitric oxide, dopamine. I mean, the list goes on in everything that comes together when you are improving your circulation. We can increase circulation through walking. Walking is extremely important. The calf pump that we have behind our leg, our arch, it's all very important in improving the circulation in our body. Also stretching. Doing stretching can be very helpful. And then, of course, eating proper foods. All that plays a big part in improving our circulation. And there's also something to be said about actually the utilization of dry heat and negative pressure as well. And there are things on the market that help increase the microcirculation in that respect. And the one technology is known as the AVACEN, which I won't speak about right now, but it is a very important technology in which it does heat up our body and can really assist it to heal ourselves. Another way we can do it is through pulse and electromagnetic fields. And when a pulse and electromagnetic fields are in contact with our body, you actually get a rearrangement of the iron that's in our hemoglobin. And it also sets up these microcurrents where they're flowing much smoothly. So that's another scientific basis of how you can increase microcirculation. So when the microcirculation is working very well, we have red blood cells that are happy, they're being very flexible, and they're moving through the smallest of channels. And that's what they're able to do. An average red blood cell is about 4 or 5 microns, and the smallest capillary can be 2 microns. So the red blood cell, under optimal conditions, can flex itself and move through there. But that's when our body is functioning properly. So this is all very important in how we can optimize our health from the inside out. Thank you. Okay. All righty. Oh, you're muted, David. David, you're muted.
Here we go. Okay, I've got a couple slides here, Denise, that we added
okay.
today. Are you seeing those on the screen?
Yes, yeah.
Okay, great. So go ahead and feel free to.
Oh, yeah, and that's just kind of confirms what I said before, that ways to increase our circulation through walking, yoga, stretching, maintaining a healthy weight, massage, of course, stimulating the lymphatic system. That's all very, very important. And then the proven scientific modalities, applying dry heat in a vacuum, rising the temperature of the blood flowing in the body, and then utilizing the pulse electrical magnetic fields to induce the microcurrents by use of the iron in the hemoglobin to regulate the flow. Okay.
Okay. Any questions for Denise?
I don't really have a question, it's Holly here, but what I'd like to say is that, that was really good. I always like, for me it's a review, but it's like was really had a lot of information and just spoken really well, with reminding me of certain things about how important that microcirculation is.
Yes.
A lot of times when I'm working with the body's ability to self-heal, I'm talking to my patients really about that microcirculation. And if that's not working well, they're not healing well.
Mm-hmm.
So, I really appreciate the in-depth look at this again. and to remind me again of why it's so important
Yes.
with my patients, Yeah. So thank you.
Oh, thank you. Thank you.
Now, as a runner, I've sprained my ankle a few times out there, and I'm sure others have had injuries. And you hear the old thing, rice is the is the traditional approach. I don't even remember what that stands for. I think something like rest.
Rest,
Ice.
ice, compression, elevation.
Okay. Well,
But the ice is good, like initially, because you want to help limit the amount of inflammation that gets there to a degree. But then afterwards, we're actually talking about when you want the healing process, we need more oxygen to get to an area. And the best way to do it is through our red blood cells, because that's what carries the oxygen.
mhm.
So we need to get red blood cells to that area. And that's when you increase microcirculation. That's when a lot of the pain can start to dissipate, because it's going to go to the places that do hurt.
Sometimes it seems the natural inclination is to just be not use the muscle or the part of the body that is hurt, immobilize it. That's the word I was looking for.
Right.
I found myself that healing takes a lot longer when you immobilize an injured body part, and that to the extent that you can continue using it. And I guess it's because of what you've explained here, the microcirculation, when you continue in motion, and definitely not re-injuring yourself, but if you can continue moving, that the healing is accelerated. Is that what you've experienced?
Well, I think like if you have a fracture,
Mhm.
things have to be immobilized,
Mhm.
or like you've had a tendon repair, or, things have to be, they have to set so they can heal. But after that certain amount of time, then you've got to get the part moving again. You've got to go through the therapy. You've got to go through the different modalities, such as heat or ultrasound, TENS unit, different things like that, in order to stimulate and get circulation to the area. And of course, the muscle needs it as well, because that's going to also atrophy and waste away.
What's the difference between a traditional medical approach to injury and an alternative health approach? I know there might be a number of differences, but
Well, I think when we look at traditional medical, we're going to look right away at, let's get rid of the pain, with pain medications, utilizing maybe anti-inflammatory medications. When we look at something, maybe immobilization is necessary. But when we look at doing something naturally, we're going to look at how the body can heal itself. Can we do things such as different types of supplements? Can we also utilize a modality such as, like I said, the AVACEN it's called, and that's vascular enhancement, in which it's dry heat and negative pressure. Can we also use something like pulse electromagnetic fields, because it's going to go to the area and start healing the area. So what you're doing from a more alternative approach is, once again, the body is healing itself.
what are pulse electromagnetic fields?
Well, what that does is it's going to rearrange, it's going to hook up with the iron that's in the red blood cell and help to have it flow better, help to do a more uniform flow. And when it has a more uniform flow, then what it's going to do is help heal, because you're getting flow to an area.
There was a time that I've known people who have been in a kind of network marketing
Mhm.
thing that employs magnets. I don't know if you've heard of that,
Oh,
that
yes,
you
yes.
wrap
I've used
mag.
magnets as well, and that does the same thing.
Okay.
It forms the type of frequency in which what you're doing is, once again, you're helping that balance with inflammation, and you're helping the red blood cells get to that area. You're increasing the circulation. Magnets have been utilized in Asian medicine for a long, long time now.
Hmm.
Long time. In fact, probably one of the best companies does come out of Japan. Yes.
Okay, so you've seen that
Oh, yes. Yeah.
used, and it sounds like you speak favorably of it.
Oh, yeah. Magnets, I've utilized them for years. Yeah, I've been through all that. Yes. And they all have a role. They all have a role in helping people with regaining and maintaining their health. And there's even like what Holly does with the energy and the frequencies. It's just amazing how we need to bring our body back into balance. And the other wellness that we're embarking on now, the triple crown of wellness, brings in quantum energy, and how that helps our cells talk to one another and helps to bring them into resonance, which is very similar to what Holly does with bioresonance. So it's all full circle. It all is intertwined into having the body heal itself and become back into balance.
Yeah, Denise, you were saying with the magnets, I sometimes like to give people an example, especially if they don't have any health background. And I'm using words like, it's flowing out of my mouth and easy, and I'm understanding everything you're saying. But if someone's not had the exposure, that's a lot of different types of words for them to understand. So with the magnets, I've been using magnets in my washing machine for almost 15 years at least now. And I don't use laundry detergent. I haven't used it for 15 years because the magnets actually cause the dirt particles to release their hold in the fabric and then just be rinsed out with the water. And it's
I've
kind
never
of
heard
like,
of that.
yeah, I've been using them 15 years now. And what's really cool about that, when you think about it in application to the blood, when you got those magnets, they're attracting the iron aspect of that. It uncouples the blood cells that are maybe all squished together and don't flow very good by each other until where they're free flowing around each other and by each other. And so the blood flow is better than when they're all clogged up together, stuck together. So it kind of makes the viscosity of them really smooth. Yeah,
Amazing, amazing.
yeah.
So here's a question. Somebody comes to you with an injury. They've sprained an ankle, they've pulled a muscle, they've got a knee injury that they received from just their activity. They tweaked something wrong, a back pain or injury. What is How would you approach that? I know everyone's different, and every injury is a little different, but what are some of the things that you would suggest?
Well, what I would suggest is once we made, the diagnosis as to what's going on, whether they have to be immobilized or not. I think also if they do have to be immobilized for a while, then let it heal. Once it has healed, probably best to do a physical therapy regimen, which could be, very, very helpful to get the part moving again, especially if it's an ankle. They need to have a better function. They need to get the calf working better. Even utilizing things to enhance the circulation, like we spoke about today is going to help them quite a bit, because what's going to help is the swelling is going to be reduced. So this is everything that can be done without them having to take medications. They can go on certain types of supplements to get down the inflammation. And all that plays a big part. Eating properly, not having an inflammatory diet, more of an anti-inflammatory diet, wholesome foods, that can all be very helpful. I'm very much into the use of, the hydrogenized water, which can really help to detoxify the body as well. So it comes together as what can you do to help the body heal itself.
Okay. Any other questions? We have the expert here. Okay, well, tell us about the Triple Crown.
Okay. Well, the Triple Crown of Wellness was brought upon by Janet Franco. And we have now formed a whole collaboration of people in which we are looking at certain aspects of alternative modalities that can be utilized all together. We look at the importance of microcirculation. We look at the importance of DNA repair and supplementation, and how that can help the body to heal itself. And then we also look at neurofeedback and quantum energy. And we look at all those different facets of those modalities coming together as being a very powerful way of helping people heal themselves. And we can be talking about anything from traumatic brain injury, mental health, mental conditions, also chronic diseases, diabetes and high blood pressure. Just the list goes on, especially when we talk about like even brain diseases and how the increase of the microcirculation, the neurofeedback helps to reprogram the brain. And then also something as quantum energy, which is frequencies that are going to realign the body at a cellular level. And so what we're doing is the end of February 29th, Leap Day, we're going to leap into the Triple Crown of Wellness and kick it off. And this is going to be a education webinar, webinar as well as it's going to be live here in Las Vegas. I can send everyone the link to sign up. And it is going to also be webinar. It's also going to be based where we're going to educate and support and train different professionals with these modalities to help their patients and clients with whatever type of issue they have that we can apply to this.
Okay, yeah, I'd be interested to know where that's going to be held, and it's for health providers?
No, the initial one we're going to have anyone can come. The initial one, that's February 29th. Then after that, we are going to be doing a doctor's program, and we're also going to be doing programs for, lay people that want to learn more about it.
Amazing. Well, that's quite an accomplishment.
Yeah.
Now, give me an example. Somebody comes to you and you apply this approach that you're going to be unveiling. Give me an example of what would they be bringing in terms of their health condition, and how might you go about treating that?
Okay, well, for example, if you've had someone that has suffered from depression and anxiety, chronic pain for many, many years, been to doctors and on different medications, and then develop possibly an opioid, narcotic dependence. I think the best ways to start is with a neurofeedback, let's say. If you start with something like says neurofeedback, what that is, it's not invasive. It's when they do the EEG and then they get a brain mapping. And you're actually able to see what's going on with the brain. What are those areas of the brain that need to be retrained? You know, maybe they did have an injury years ago that's led to all this, you know, problems that they're having. So a brain mapping is very important. Also, the chronic pain that they're having needs to be addressed. And they may, in fact, need something like we call the AVACEN that we discussed, which is something that they put their hand in. It warms up their hand through negative pressure and dry heat. That warm blood goes through their body and is starting to help to heal those areas that need more circulation. So that's very possible. That could be a big help. Then another way is also to add in DNA guided supplementation. Maybe there's something that they're lacking, that predisposed to, that they need to have in their body, some sort of supplement. And by doing something such as DNA guided testing, in which a swab is taken inside of their mouth and then a mapping is done with the DNA, then we can determine if there is truly things that they need to help them with their mental problem, depression, anxiety. So it could also be a nutritional aspect as well. And then you can also add quantum energy in there too, by something that they can wear on their wrist, and that is also going to help to realign them. Their cell-to-cell communication, the cell resonance, is also going to be realigned by the quantum energy that they'll wear. So it's all very, very exciting modalities that really go hand in hand.
And it's you and Janet and Holly, is it? Or who are the?
Oh, no, Fran is part of it.
Fran, okay.
Yeah, Michael Yanez, and he's part of the marketing team.
Okay.
Yeah. Mm-hmm.
Very good.
A bunch of other people that are coming together to really make this something that we can just take it anywhere, and really help healthcare providers, as well as, you know, people that want to know more of how they can regain and maintain their health.
That's exciting. I look forward to hearing more about that.
Okay, thank you.
Do you have anything out there yet? A website?
Yes, yeah, we do have the website. You can go to www.soulful.com.
What.com?
Soulful, SOULFUL, Rosie.com. Yeah, soulfulrosie.com. That's Janet's website.
ROSY or ROSI?
Rosie, IE.
Oh, IE?
Yeah, .com.
Okay. Am I still sharing the screen here?
Yeah, you're good. Yeah.
Okay, good. Okay.
Oh, yeah, then you can go up where it says Triple Crown.
Okay.
And then you can go to Triple Crown Curriculum, yeah, and that's what we're going to be embarking on. Mm-hmm.
Okay. Very exciting.
So that's everything that I spoke about right now, and then there's me, because I will be the one that will be doing the training, the presentations, and
Very good, Denise.
and that talks about the whole synopsis of what the Triple Crown curriculum is.
Mm-hmm.
Mm-hmm. Yeah, and I can send you the information. On February 29th is our kickoff, and we'll be in Boulder City.
Okay.
Yeah.
Definitely want to see that.
Yes, yes. Yeah, yeah. I'll
Okay.
send you all the an invite on Facebook. We've been really getting it out there. It's just so exciting. You know, my passion I have for educating, empowering, and just want to spread the word on that there's so much more out there. And, you know, especially doing all these webinars, and, you know, we just have such a litany of information, and we just need to, you know, spread it out for everybody. That's it.
Well, very good. Okay. Any final comments here?
Hi, this is Fran. I just want to say also, this is a free event. If anyone would like to come, we would love to have you so we can get this out to all types of people in the Las Vegas area. And Dr. Denise, you did a great job.
Thank you, Franny.
Excellent. Well, if you can send me that information, and I have a networking announcement that goes out every Tuesday that I send out to a huge number of people in the Las Vegas area, and would be happy to add that to it.
Awesome. I'll get your email from Dr. Denise.
Wonderful. Okay. And by the way, to see the webinar replay, you'd go to the health education link of Las Vegas Area Trails, click on boosting the Miracle of Microcirculation, where the little hand is here. And the webinar replay will be right here. The webinar slides are all below, along with the notes from the presentation, which are basically the notes on the slide. So you definitely can take away some of the information that maybe you did not have in your notes. Okay.
Okay, great.
Well, thank you everyone for being present, and it's good to have, you know, Fran, Michael, Janet here with us for the first time. I think Janet may have been here once before, but good to have you folks with us, and you're welcome anytime. We will be meeting in a couple more weeks to have an additional webinar and continue our series.